Forgot that we're live. Checking to make sure we're live on Facebook, YouTube, Instagram. Restarting now because I was not live on one of those platforms. So hopefully things are working as they should right now. I am the founder and CEO of DeShawn Family Planning in Phoenix, Arizona. And welcome to Well Woman Wednesdays, where I come on around noontime in Arizona to talk about some important topics in gynecology and well woman care in general. And today we'll be talking about chlamydia. How serious is it? So again, I'm Dr. DeShawn Taylor. I'm a board certified gynecologist and family planning specialist. And I am the primary provider at DeShawn Family Planning, for which I am also the owner. And let's get started. Now, chlamydia is the most common reportable sexually transmitted infection. And most people who have chlamydia do not know that they have it. And so it is very important for you to understand what chlamydia is, how you get it, how you know you get it, because many people who have it don't know they have it. And there are some serious consequences that come from untreated chlamydia infection. And so if you have a chlamydia infection and it goes untreated, it can cause an infection in the upper genital tract for women. That includes the uterus and the tubes, and that is called pelvic inflammatory disease. And so when someone has pelvic inflammatory disease, that can cause scar tissue in the tubes, which can lead to difficulty becoming pregnant, which is called infertility. And it can also cause abnormal implantation of a pregnancy in the fallopian tube, and that is called an ectopic pregnancy. And an ectopic pregnancy is a very dangerous pregnancy that can be life-threatening if it is not diagnosed in time. And so there are a few different ways that you can contract chlamydia, and it is involved with sexual activity. So you can contract chlamydia by oral, vaginal, or anal sex. And this is really important to understand. Also, that if you are having sex with a partner that has a penis, that it is still possible to contract chlamydia even if that partner has not ejaculated. Because the chlamydia can be in the pre-cum as well. Okay, and so the way that you minimize your risk of contracting chlamydia is by not having sex. So that's the first thing. And then if you are sexually active, then it's really important to use condoms when you are having sex that involves a penis. And the other part of this is having sexual activity in a monogamous partnership with someone who you also know is free of sexually transmitted infections. And so, again, how can chlamydia be so serious? It's treatable, right? Well, yes, it is treatable. But the important thing is, because so many people have chlamydia and don't know they have it, then they're not getting treated. And so that's why it's so important for you to know your status. The Centers for Disease Control recommend that people 25 and younger who are sexually active just routinely be screened for chlamydia because it's so prevalent and people generally are asymptomatic with this infection. And so in my practice, it's something that I offer all the time for that age group. And then also I offer testing for everyone. Here are some other reasons that you should get tested. You have a new partner. You have multiple partners. It's just really important for you to be proactive in being tested for sexually transmitted infections so that you don't have untoward complications from something that you didn't even realize you had. And so, as I mentioned, chlamydia is usually without symptoms. But then people who have symptoms, there are some things that you do want to look out for. And so for women, that's going to be an abnormal vaginal discharge. And so there is a normal discharge that women have that we call physiologic. And so generally it can be clear, slightly white. It generally doesn't have an odor to it. And so if you notice that there's an increase in that amount of discharge, there might be a change in color or a slight odor, something like that, then that would be a cause for you to reach out to your healthcare provider to have that evaluated. Another important symptom is a burning sensation when you urinate. And so that could be a sign of urinary tract infection, but it can also be a sign of a sexually transmitted infection. And symptoms in men can include a discharge from the penis. And that one is really important because men generally don't have a discharge from the penis. So although women can have a physiologic discharge, it's not normal that men have discharge from the penis. So that's going to be a very important factor in being evaluated for sexually transmitted infections. Another important symptom in people with penises is a burning sensation with urination. It's very uncommon for a person with a penis to have a urinary tract infection. It's not impossible, but it's very uncommon. So generally, when there's burning with urination in people with penises, that's usually a sign of a sexually transmitted infection. And also there could be pain and swelling in one or both testicles. And so someone asked a question about levels of risk between same-sex partners. Now, we often, when we're talking about sexually transmitted infections, we're generally talking about transmission in sexual activity that involves penis. So that's penis to vagina, that's penis to rectum. But again, I did mention that oral sex is possible to pass chlamydia. Now, in our traditional thinking about sexually transmitted infections, generally there is at some point contact with a penis in terms of sexual activity where a person contracts chlamydia. But then in same-sex female to female sexual activity, if the partner has chlamydia in their mouth, then that, or in their genital area, that can be passed back and forth. And so it's unlikely for female to female transmission of chlamydia. However, if there is a penis anywhere potentially involved with one or both of those partners, then that increases the chance that those partners could contract chlamydia and then pass it amongst each other. And so that's kind of the traditional thinking around female to female transmission. Definitely there is the transmission of chlamydia between male to male sexual activity. And one of the concerns about transmission in male to male sexual activity, and also too, this can apply to male to female activity that's anal. The anal region is very sensitive and it can be prone to tears and that type of thing. And it just seems that for some reason that is an important factor in transmission of sexually transmitted infections in general. So I hope that answered the question that was posed there. And so I always want to kind of bring this back to really, it's part of being your healthiest and living your best life, because most sexually transmitted infections are treatable. Although chlamydia is the most common, it is absolutely treatable. And so once you're treated, how long do you wait before you have sex? Now, the most common treatment is one single dose of an antibiotic. And once you've been treated and you know that your partner's been treated, then you want to wait 7 days before having unprotected sexual activity with someone after you've been treated. Now, there are still some providers who are providing a 7-day course of antibiotic to treat chlamydia. And if that's the case, then you want to complete the full 7 days before having unprotected sex with someone who you also know is chlamydia free or has completed treatment as well. So if you're with someone who you're both being treated for chlamydia, then you both want to be sure that you've taken your medications and waited the 7 days after the single dose treatment, or that you've completed the full 7-day treatment before you resume sexual activity without condom with that individual. And so again, I do want to highlight that you can contract chlamydia in the rectum. And so that happens by having receptive anal sex or by spreading it from another infected site, like such as the vagina. So activities that are moving bodily fluids from the vagina to the rectum. So this can cause rectal pain, discharge, and bleeding from the rectum would be a sign that there's an infection going on there. And so again, the take-home points here is that chlamydia is the most common reportable sexual transmitted infection, and it is treatable. So participate in routine screening, even if you don't have symptoms, so that you can know your status and receive treatment early on, so that you don't develop the sequelae of a serious chlamydial infection that you didn't even know you had. And there aren't very many long-term effects in men related to this. However, for women, it can lead to pelvic inflammatory disease, which, if goes untreated, can lead to infertility, ectopic pregnancy, which could be dangerous to your life, and chronic pelvic pain from scar tissue formed from that. So I hope this has been helpful to you today, and please share, and so that someone that you care about also gets this information. Again, I'm Dr. DeShawn Taylor. My practice is Desert Star Family Planning in Phoenix, Arizona, and we are accepting new patients. So I hope to see you. Follow us on our Instagram, Facebook, YouTube channel, and we'll see you next Well Women Wednesday. Have a great day.